MRD is not useful for diagnosis of follicular lymphoma, but is a prognostic tool. So we study MRD after treatment or during the course of treatment or during the follow-up. Some data now shows that also MRD negativization in the course of treatment, so after 3 or 4 cycles of therapy, is prognostic, is predictive of a better outcome if negative. But MRD is also classically predictive at the end of induction and during the follow-up or the maintenance with the Rituximab. So it is useful to monitor MRD, especially in peripheral blood, so not invasive blood examination, peripheral blood examination, up to 36 months after the end of treatment, after the achievement of complete molecular remission. Because, as I said before, positive MRD results also in PB during the observation or Rituximab maintenance is associated to POD24 and to a higher risk of relapse.